Hi, in previous series of videos, we've been looking at the release of neurotransmitters, the effect it has on mood and behaviour, as well as some of the disorders due to a lack or excessive amounts of these neurotransmitters. So we'll finish key area 3.4 by looking at how recreational drugs can also affect the normal neurotransmitter function. So, similar to when we looked at the different medications to treat the disorders, many of these recreational drugs and chemicals will also act as those agonists, the mimickers, or the antagonists, the blockers. So, because these drugs can affect the release of neurotransmitters at synapses within the brain, that's why they can have this wide ranging effects from altering mood to altering cognition, perception of your environment, and also your behaviour. And we know that many of these recreational substances also induce or activate the reward pathway, so the release of the dopamine and the triggering of that feeling of pleasure and well being. So, although again we know that smoking and drinking and some of these other more serious substances can be really harmful to us, because of the release of the dopamine and the activation of the reward pathway, we still repeat these behaviours and it changes our mood and it changes our behaviour. One of the potential consequences of repeated exposure to some of these substances is drug addiction, and this comes about through repeated use of the antagonists. So if you take a substance that normally blocks the neurotransmitter receptors, then this sort of fools the nervous system into thinking there's not enough of that neurotransmitter there. So to compensate, it increases both the number and the sensitivity of these receptors. And it's this sensitization that leads to the addiction, whether it be a recreational substance or a prescribed medication. As long as an antagonist, you risk this sensitization, which leads to craving more of that substance and thus the addictive behaviours. Another potential issue through overuse of this time the agonist is what we call drug tolerance, and again can be an issue for both recreational substances and prescribed medications. So, repeated exposure to these agonists, the ones that mimic the actions of neurotransmitter, again is tricking or fooling the nervous system this time, and that there is too much of that neurotransmitter. So the effect that we see is essentially the opposite of what happened during addiction. So this time we're decreasing the number and the sensitivity of these receptors, which is known as desensitization, and this is what builds the drug tolerance. So the individual would have to take more and more of the substance to get the same effect. So addiction and tolerance are huge problems for us societally and in the healthcare professions. So here are some past paper questions related to the effect of these substances on neurotransmission. So pause the video, have a go and hit play when you want to see the answers. So the first question here tells us smokers can become addicted to the nicotine in tobacco. Nicotine acts as an agonist of acetylcholine, causing an increase in the levels of dopamine. And you're to describe how nicotine acts as an agonist at the synapse. So, first off, again, you would never be expected to know which particular drug or substance acts as an agonist or an antagonist. Everything you need will be within the question itself. So, it's about tailoring your response to your example. So, in this case, we know that nicotine binds to the acetylcholine receptors, that's the neurotransmitter in this example. And you can see it says do not accept answers that state neurotransmitter instead of acetylcholine. So do make sure you're specific to your particular example. Or you could have worded it, nicotine mimics the action of acetylcholine because you are told that it is an agonist. Question C. Many drugs which affect synapses may cause sensitization over a period of time, and describe the effect that sensitization has on the synapse and the consequences for the individual. So there's no named example, so you can keep it a bit more general in this case. So the effect is an increased number of receptors or increased sensitivity of these receptors, and the consequences is addiction. So sensitization, so increase to the receptors, and that's what leads to addiction. Final question, you were asked to describe how repeated exposure to nicotine can lead to nicotine tolerance by desensitization. So it causes a decrease in number of sensitivity receptors, which is the opposite for the sensitization and the addiction. Again, hopefully this has helped to make sense of this key area and this topic, but if you do have any questions, please let me know.